What mental disorders does the Joker have in the Joker 2019 film? This video is a character diagnosis performed by University of Washington undergraduate students R.J. Sincioko and Cameron Gerke. We selected this film to analyze its protagonist's mental disorders due to the huge awareness the film has brought to mental disorders at its time of release. It is also important to note that this movie inaccurately displays as a person with mental disorder being grossly violent, even though this is not always the case for those with mental illnesses. In this video, we will be discussing Arthur's, aka the Joker, mental illness and etiology, or causes of the disorder, and evidence seen in the film that supports the diagnosis. We believe that the Joker has antisocial personality disorder, major depressive disorder, delusional disorder, and perhaps narcissistic personality disorder. Throughout the movie, Arthur violated the rights of others, has suicidal thoughts and depressive moods, and has several delusions. Antisocial personality disorder is the adult version of conduct disorder seen in children. Children with conduct disorder are more likely to have parents with antisocial behavior due to the correlation between environmental and biological factors influencing the development of the child. Research is still being done to determine what factors influence the development of conduct disorder in children. These children are believed to have neurological deficiencies in the parts of the brain controlling planning and behavior, as well as reward and punishment. ADHD usually accompanies conduct disorder, and it is believed this is because both disorders show abnormalities in the brain corresponding to the response to emotional stimuli. Most people suffering from depression report a negative life stressor before the onset of their depression. There has also been biological factors that increase the risk of depression, such as parents or other family members having depression. Major depressive disorder can also be brought on by a lack of neurotransmitters such as serotonin and dopamine. Delusional disorder is rare and therefore difficult to study clinically. The cause is currently unknown, however. Some studies suggest that delusions can develop as a way to manage extreme stress or deal with a history of trauma, two things that Arthur is shown to be dealing with throughout the movie. Genetics may also contribute to the development of delusional disorder. Individuals have a higher risk of delusional disorder if they have family members with schizophrenia or schizotypal personality disorder. Psychopathy, also known as antisocial personality disorder or conduct disorder, involves an individual repeatedly violating the basic rights of others or major age-appropriate expectations or rules with respect to at least 3 of the 15 criterions associated with conduct disorder within the past 12 months, with one of the violations being within this past 6 months. Arthur performed many of these criterion, including the use of a weapon resulting in physical harm and even murder to others throughout the film. Arthur even broke into an apartment next door. Arthur also initiated a fight towards the end of the movie with TV show host Murray Franklin, which ended in the Joker shooting him. I might say that the TV show confrontation was more about the Joker picking a fight with the world and not just with Murray. Narcissistic personality disorder involves individuals acting in a dramatic manner, seeking admiration from others, and they have shallow emotional expressions and shallow relationships with others. Arthur exercises a shallow relationship with his mother after finding out how much in his life she had been lying to him. For example, lying about who his father was and the fact that he is not actually her son. After finding out these huge hidden aspects about his life, he smothers his mother with a pillow. Theory suggests that people with narcissistic personality disorder did not develop healthy ways to deal with stress or distress when they were children, so they seek validation through the domination of others. Major depressive disorder cannot be applied to an individual who has a depressive response to a negative event, like a depressed mood or loss of interest, unless there are 4 other symptoms like worthlessness, suicidal thoughts, severe impairment, and psychomotor retardation accompanying their main symptom. People diagnosed with major depressive disorder also must be in a severe bout of depression for 2 weeks or more to be diagnosed. In the film, Arthur's notebook had a note that says, "I just hope my death makes more sense than my life." More than 70% of people diagnosed with major depressive disorder also have had another psychological disorder at some point, sometime in their lives. The Joker may have been suffering from an eating disorder such as anorexia nervosa, since he was severely malnourished throughout the film, so much so that he looked like a skeleton in a skin suit.
Hi, my name is RJ Sincioko, and I will be reading the rest of the character diagnosis. One thing I would like to note is that one of the diagnostic criteria for narcissistic personality disorder is that the afflicted person does not have empathy. In the beginning of the movie, Arthur is seen having empathy for his mother, including feeding her food, giving her baths, and even tries dancing with her to make her happy. However, towards the end of the film, Arthur loses his empathy after finding out about his mother's abuse and neglect towards him as a child. Past this point in the film, it's obvious that Arthur loses his empathy. Also, in the director Todd Phillips' interview about the mentality of the Joker, he describes Arthur as the ego and the Joker as the id, and by the end of the movie, the id takes over. The delusions that Arthur has throughout the film is also one of the most interesting highlights of his mental disorders. This aspect of the film was not revealed until near the end, where it is shown that the relationship with the female protagonist, Zazie, has all been one big delusion. From his first conversation with her to their first date, to the time she visited Arthur and his mom at the hospital, all of those were delusions that Arthur had. These delusions are classified under the erotomatic type of delusions. Also, throughout the film, Arthur imagines that he is on the Murray late night show with Murray Franklin, and even imagines Murray telling Arthur that he wishes he had a son like him because Arthur is such a successful and funny comedian. This type of delusion is classified under the grandiose type of delusions for delusional disorder. For delusional disorder, major depressive disorder, and antisocial personality disorder, the movie accurately highlights different portions from the various disorders. However, for narcissistic personality disorder, there is not very much evidence seen for this disorder other than the fact that the Joker had no empathy by the end of the film, caused harm to others for personal gain, and saw himself in a grandiose delusional way in which he was a top comedian. The film was also unrealistic because it portrays mentally ill individuals as violent and dangerous to others. In the movie, there is not really another mentally ill individual seen that does not cause any harm either to themselves or others. Both the mentally ill protagonists, Arthur and his mother, have been shown as hurting others. Arthur to those who have wronged him, and Arthur's mother to Arthur. Now moving on to treatments for the disorders. The treatment for delusional disorder includes psychopharmacology and psychotherapy. Antipsychotic medications are also recommended to treat this disorder. Effective methods for treating major depressive disorder are antidepressant medication to increase the brain functioning of the prefrontal cortex, cognitive behavioral therapy, to retrain the individual's thought process, and electroconvulsive therapy has been seen to promote the growth of new neurons in the hippocampal region. People with narcissistic personality disorder can be treated effectively simply by talking to a therapist. However, this tends to be difficult for both individuals because of the self-elevating behavior of the patient. No medications or psychotherapy has been shown to work effectively for narcissistic personality disorder. Delusional disorder treatment relies heavily on the use of psychotherapy of various forms, including individual psychotherapy, cognitive behavioral therapy, and family therapy. Medications like antipsychotics can help with recovery as well. Patients with severe symptoms that may be at risk of hurting themselves or others, unfortunately, have to be hospitalized until they've recovered adequately. Throughout this video, we have discussed the mental disorders seen in the character Joker, the causes of the disorders, evidence that supports the presence of the disorders, and treatments for the disorders. The Joker is played by Joaquin Phoenix, directed by Todd Phillips, and released in the year 2019. Thank you for watching.